mental health disparities for minority adolescents, presented by me, Robin Ontiveros. Introduction. A major issue in adolescent development is the racial and ethnic disparities in mental health care for minority youth. These disparities include limited access to behavioral health care, heightened stigma in diverse cultures, and the neighborhood effects on minority adolescent health. These specific groups of adolescents are more likely to have additional stressors, such as facing racism, discrimination, and poverty. Current research focusing on groups that include African American, Latinx, Asian, and American Indians show these populations tend to face higher rates of disparities that include poverty, lack of education, barriers to mental health service, and community violence exposure. In order to decrease the number of adolescents engaging in criminal behavior, along with promoting interventions that are needed for mental health disorders, we can help with better development for minority adolescents. The literature review. During adolescence, social and cognitive development are active and engaged through constant social interactions. Vygotsky and his theory of cognitive development state that human interaction in a social context enhance learning and are a fundamental part of development. Minority groups carry disparities with them that lead to psychosocial developmental issues, yet the mental health service system is more geared towards middle-class Caucasian individuals. Furthermore, research has found that Black children have twice the suicide rates than their white counterparts. Minoritized communities experience racial trauma while lacking the proper resources to address these health concerns. Studies show that the most common reported reasons that adolescents do not seek care in regards to their mental health include cost of seeking help, the risk of deportation if they're immigrants, historical oppression, and cultural mistrust in the system. The literature review continued. Research using the ACE scores have found that impact ACEs have on adult mental health and targeting protective factors can reduce the negative impacts from these adverse circumstances that they experience. Additionally, results show that minority youth who experience more adverse circumstances had access to fewer protective factors, had lower SES statuses, and overall worse health. And that's mental and physical health. Furthermore, research that focuses on positive youth development using a model of resilience that focuses on adolescents experiencing adversity can display good adaptation or positive developmental outcomes when that model of resilience is applied to them. So these are a little bit of evidence that research shows of some things that can be effective in helping minority adolescents in their mental health development. So some intervention plans. One, it could be taking into consideration the macro level aspects that play a role in the development of mental illnesses. Practitioners can look at adolescents using Bronfenbrenner's bioecological model as shown on the right, and the indirect aspects that impact their mental health, taking into consideration things such as their family, their schools, neighborhoods, socioeconomic status, school boards, healthcare, and attitudes or beliefs towards mental health care. Providing mental health care access in schools and neighborhoods is another suggestion. Research shows that providing mandatory suicidal risk screenings in schools could better show the at-risk populations within a timely manner, providing interventions to lessen the suicide completion rates. Another plan could be creating a community advisory board to help with the violence exposure and health disparities encountered by adolescents, and using these boards to help them strive within their community. States have eliminated more than $1.6 billion in funds from their state mental health agency budgets. Policymakers should reconsider their fundings for mental health services, and especially in low-income communities where these minorities are. Intervention effectiveness. A community-based intervention conducted by a nonprofit in Africa provided support of low-cost and low-stigma mental health treatment. They found this intervention provided empowerment and appropriate therapies to their communities. Implementing a school-based health program can increase care among low-income minority youth and increase positive attitudes towards mental health. Community centers set up to help adolescents strive and find help for their mental illness can develop resilience. As as research has shown within the paper, taking in small groups, talking in small groups, being around others, and having adults that can help them uncover their ability to thrive and adapt even through adversity or trials they face can create resilience. So using those resilience models, talking in small groups, having a safe place to go to where they know that they can go for help if they're experiencing anxiety or if they're thinking about suicide or any of those behavioral health issues, just having a place that they could go to within their schools, within their communities, having the boards. All of these could prove to be effective. So what are some cultural adaptations that can be applied, especially when we're focusing on minority adolescents and their mental health? So one critical issue that researchers have found is a gap in mental health services that address cultural needs of minority populations. To lessen the stigma around mental health, research suggests increasing responsiveness to immigrant needs, recognizing the influential roles of family experiences, such as fear of being a burden with a mental illness. Furthermore, increasing the knowledge in society overall about cultural beliefs towards mental illness and decreasing the stereotypes. And finally, increasing coping skills for minority adolescents dealing with a mental illness by providing education and care. Community leaders and practitioners should take into account when working with these adolescents familism, family cohesion, and parental closeness of low SES families. Another step that can be taken is to incorporate more underrepresented minority leaders in the decision-making process for their own groups of adolescents and families. So having individuals on these community boards and within these communities that are a good representation of adolescents in that community so that they feel safe and more liable to go and talk with these individuals. So in conclusion, adolescence is a crucial period of development that can influence the trajectory for adulthood. A major issue in adolescent development is the racial and ethnic disparities in mental health care for minority youth. These specific groups of adolescents are more likely to have additional stressors, racism, discrimination, and poverty. In order to decrease the number of adolescents engaging in criminal behavior, along with promoting interventions needed for mental health disorders, we can help with better development for minority adolescents. Thank you for listening.